EMDR, eyes movement desensitization and reprocessing. What is EMDR therapy? EMDR, which means eyes movement desensitization and reprocessing, is a technical and interactive therapy which helps treating phobias and traumas, especially when linked to PTSD, post-traumatic syndrome disorder. During the treatment, the patient is asked to recall the bad memories that traumatized him, while the specialist is leading his eyes movement. Progressively, this technique helps to reduce the impact of the bad memories or thoughts the patient could have. How and when was discovered the EMDR therapy? This psychotherapy was invented in 1987 by Francine Shapiro, a behavioral therapist and psychologist born in Brooklyn in 1948 and deceased since 2019. During a walk in a park, she would have gazed landscape, and this simple action would have reduced her anxieties related to her cancer. Later, after making some researches, she would have discovered EMDR. Following this event, she starts making tests on volunteers, then on Vietnam veterans. Finally, she publishes the results in 1989, making her the official inventor of this method. What is post-traumatic syndrome disorder? PTSD is the scientific title for psychotrauma. Sometimes we are subject to dangerous situations. In such a situation, the level of fear is so high that people are facing a huge anxiety. Fear is a normal defense mechanism in order to keep us alive. These reactions are normal and fade a few hours after the stressing situation. Concerning the PTSD, reactions don't disappear completely, and people relive again and again the same traumatic situation with the same intensity of fear and anxiety every time. The memories come back to the person's mind throughout flashbacks, which emerge at random times or during dreams. Symptoms: intense fear, feeling of being powerless, tachycardia, tremors, chills, sweating, increased respiratory rate, flashbacks, uncontrollable thoughts, constant high alert status, difficulties to feel sexual desire, difficulties to focus, difficulties to sleep. How does the EMDR therapy work? EMDR therapy works in 8 phases. 1. Diagnosis. The therapist reviews your history by making the patient talk about his past and writes down the specific memories the patient has trouble to talk about in order to identify the traumas and to prepare a treatment procedure. 2. Preparation and relaxation. The therapist must ensure that the patient knows a few relaxation techniques and that he can cope with the bad feelings and the psychological stress he is experiencing with his memories. 3. Assessment. The therapist identifies the specific memories that will be treated more specifically than in phase 1. For each trauma, the patient associates the event with an image, representing how his brain perceives the memories. It can be a bad idea or image, called negative cognition, or a positive idea that can lift up the patient's self-esteem, called positive cognition. Then, the patient evaluates on a scale from 0 to 10 to what extent the association was right. He can also associate his emotional distress with a physical effect, ache, discomfort. 4 to 7. Desensitization. The therapist starts using EMDR therapy techniques. The patient focuses on a negative thoughts or memory, and the therapist has him to do specific eyes movements, bilateral stimulation with a light or noises, sometimes snapping fingers, in order to make the patient feel less anxious, depending on the results of the scale test. The point is to help the patient cope positively with his traumas, so that they don't affect his everyday life. 8. Final evaluation. The therapist asks the patient to think about why he started his therapy, and according to his answers, they work on another trauma or they decide to end the therapy. EMDR therapy today. EMDR therapy is mentioned not only by the American Psychiatric Association, APA, but also by the World Health Organization, WHO. In France, it is considered as part of cognitive behavioral therapy techniques, which can help desensitizing patients, unless those who suffer from a psychotic disorder. This therapy is widely used for phobias, PTSD, or extreme anxiety. It doesn't require expensive specific material and can be reproduced to treat many troubles. Controversy. This therapy is today considered as a pseudoscience, as many studies and experiences showed almost, if not, no differences between the non-EMDR therapy control group and the group treated with EMDR techniques. In addition, Shapiro was criticized for always increasing the length and strategy of the EMDR desensitization. These two reasons turned the EMDR therapy into a parapsychological technique within the psychological community, where skeptics question the real efficacy of this method beyond the effect of autosuggestion and mesmerism, magnetism. Conclusion. EMDR therapy, although very often reconsidered, has been found very useful to treat patients with no medicine, no surgery, but only a psychological follow-up and a healthy, balanced lifestyle. In order to make this therapy more valid in the psychological community, experiences and studies must be performed with the aim of proving or refuting the effects of this method.